Every year, thousands of adults and teenagers take their own life. How can you know if your loved one is at risk? How can suicide be prevented? The first step is by knowing the warning signs. There are a number of factors that can increase a person's risk for contemplating, attempting, or dying by suicide. Most people who die by suicide often have a diagnosed or undiagnosed mental illness, such as depression, bipolar disorder, or schizophrenia. In rare cases, medicines used to treat these conditions, such as antidepressants, may increase suicidal ideation or thinking about suicide. There are other common risk factors as well. These may include substance abuse, the emotional ups and downs that often accompany drug, alcohol, and prescription pain medicine abuse can worsen a person's suicidal thoughts. In fact, many people who died from suicide were under the influence of alcohol or were intoxicated at the time of death. Access to firearms. A majority of suicide deaths involve a firearm. This is particularly true among men who die by suicide. Chronic medical illness. This can increase a person's desire to attempt suicide. The impact of the chronic illness on everyday life may cause a person to feel like many factors are out of their control. There is also a link between gender and suicide. While girls and women are more likely to attempt suicide, males are more likely to die by suicide. Other factors that increase a person's risk of dying by suicide include exposure to trauma such as violence, military combat, or exposure to another person's suicide, being isolated and without support from family and friends, being younger than 24 or older than 65, having recently experienced a significant tragedy or loss, such as the death of a loved one or job loss, frequently experiencing agitation or sleep deprivation. Additionally, having a history of suicide attempts or a family history of suicide may also increase a person's risk. Most people who are thinking about suicide show warning signs of their intentions. While everyone is different, common warning signs include making threats or comments about ending their life. These comments should always be taken seriously.
I don't know if I'm going to be able to make it.
Dramatic mood swings from happy or carefree one moment to sad or withdrawn or angry at another moment. Impulsive or reckless behavior. This may include increasing their use of drugs or alcohol, or engaging in other reckless activities, such as unsafe sex. Withdrawing from normal activities or avoiding time spent with friends, family, co-workers, or classmates. Spending a lot of time thinking, talking, or writing about death, even if not directly in relation to themselves. Acting more aggressive or angry than usual. Never ignore the warning signs of suicide. When you recognize that a loved one may be contemplating suicide, it's important to act right away. If you are worried, speak up. Though it can be difficult to talk about suicide, it is important to show you care and offer support. Ask your loved one about their thoughts and feelings. To understand if your loved one may be in immediate danger, ask if they have a plan, if they have the means to carry out the plan, if they have a time set, and if they intend to take their own life. Seek the help of a mental health professional to help assess risk and identify options for further support and treatment. If you are concerned that a suicide attempt is likely, contact your loved one's mental health care provider right away. If your loved one is not currently working with a mental health professional, follow one or more of these steps. Call 911 or bring your loved one to the nearest medical facility, health department, or mental health crisis center. Contact a crisis support center, such as the National Suicide Prevention Lifeline. Do not leave your loved one alone. Remove access to items that could be used to cause self-harm, including firearms, over-the-counter and prescription medicines, alcohol, sharp objects, and anything else that could be used to inflict self-harm. This might mean locking up medications in a lockbox or safe, and asking local law enforcement to temporarily hold firearms until the crisis is over. Continue to offer support to your loved one. Even after a suicide crisis has passed, it is important to check in regularly and encourage your loved one in the recovery process. Part of the recovery process may include regular therapy with a mental health professional. Different therapy approaches can help identify unhealthy thought and behavior patterns, acknowledge feelings, and build coping and problem-solving skills. Mental health support can also help you and your loved one develop a safety plan that includes coping strategies and who to contact during a crisis. In some cases, medicines may play an important role in the recovery process by addressing underlying conditions such as depression or anxiety. If suicide attempt continues to be a risk, you may need to keep these medicines in a safe place and administer them to your loved one each day. Additionally, lifestyle changes play a complementary role to mental health services and medicines in the recovery process. These may include healthy eating, regular exercise, adequate sleep, and relaxation techniques such as meditation. Your ongoing support in all parts of the recovery process is vital to your loved one. Suicide is a tragic event which affects the entire family and is entirely preventable. Knowing the warning signs and knowing how to act can save a life.